We know COVID can have a lasting effect on our bodies, and for some people, it could take months to get back to normal. Our Tevis Hillis sits down with the man who is still struggling more than a year later.
Now an all too common story.
He was in the hospital 26 days, on the ventilator 10, in ICU 20 days.
Families like the Osbornes not seeing their loved ones for months as they lay in a hospital bed fighting to survive. Now doctors are working on finding solutions to these long-haul COVID-19 symptoms.
And those things could be anything from fatigue, which is a common thing that people complain of, but also sometimes memory loss, things that one can detect on blood work, such as kidney damage.
There's an array of what can happen after having COVID. Vital organs can easily be damaged.
Kidneys work as the filtration system for the whole human body.
Rick Osborne is just one of the many examples of lingering side effects after having COVID-19.
He is diabetic, and then complications with being so severely ill with COVID harmed his kidneys.
In 2021, Rick was admitted to the hospital, and the weeks he spent inside the hospital just destroyed his kidneys. According to Johns Hopkins, more than 30% of patients hospitalized with COVID-19 develop a similar side effect. More than 50% of patients in the intensive care unit with kidney injury may require dialysis.
I will tell you why I want him around. I've got the best husband on the planet.
But with the need of a new living kidney that could take a long time to get, an average waiting time for a kidney, 5 years, and hundreds of Oklahomans are on a list for one. Another story of how COVID-19 affects lives to this day. For Oklahoma's Own, I'm Tevis Hillis.
And nationally, there are about 90,000 people on the transplant waiting list, and of that number, there are 540 here in Oklahoma. On average, the wait for a transplant takes 3 to 5 years.